I'm Dr. Joan Arvedson, a speech-language pathologist at the Children's Hospital of Wisconsin in Milwaukee, and spend a lot of my time working with families and babies and children who have problems feeding and swallowing. Often when parents of children who have feeding and swallowing issues are looking at how do I get the best help? What kind of help do I really need to work with me, our family, as well as our baby and children to help them be able to eat and drink, which is what we want every child to do if we possibly can. We often say it takes a team, but those teams can differ at different times and in different locale or settings because different people are available to do that work with families. Let me first say the most important people on every team and the head of every team, it's the parent and the child. You are the most critical members of the team and your primary physician as well. But in many instances, the primary physician does not have the scope or all of the knowledge and the experience needed for some specific problems. So we have what we call feeding and swallowing teams, and they may go by different names. You might have a feeding, swallowing, nutrition center. That's what our team is called at the Children's Hospital of Wisconsin in Milwaukee. Some might be called a feeding team. Some might be called a nutrition team. So the names can differ. But the point is there are ways to set up groups of people who can work together in coordinated ways to make sure that we are covering all aspects of your child as a total child, or in a sense get the total picture. Most teams are headed by a physician if we have a really comprehensive team. And that physician might be a gastroenterologist. That's the professional who deals with the whole gastrointestinal tract. It might be a developmental pediatrician because that person has a lot of knowledge and experience about overall neurodevelopment in addition to basic medical kinds of concerns. They're all pediatricians to start with. So that's where their core knowledge comes from. Now, probably the most important thing is that they really have an interest in nutrition and the development of feeding and swallowing in children. Nurse is an important part of a team. There should be someone in that team who is indeed a coordinator and the advocate and the person who really helps families pull things together. And that usually is the nurse. It might differ in different places, but it usually is the nurse. She's the one, or he is the one who will ask you for medical records, ask you for reports from your therapist, from your physicians, and in our instance, we often will make a phone call back to the family, especially if they come from some distance, and I'm sure many other teams do this too, with a physician, a nurse coordinator, and maybe one or two other members of the team who would seem to be very pertinent given what you have described in the reports and extensive history that you will have filled out. So again, we can make sure that this is the best place for you to come, and that if it is, that we know what we need to do in terms of any additional testing or what the focuses should be. And I say this not just for our program, but I think that would be a very basic kind of approach with a little bit of differences depending upon the specific program. So I've mentioned the doctor, a nurse, certainly a dietitian. The dietitian is the person who really monitors the nutrition, the formulas, the types of food, the rate of weight gain and growth. So that's a critical member of a team. A speech-language pathologist is typically a member of a team, and we focus on the oral skills and the swallowing, timing, coordination, safety, and all of those aspects of eating and drinking. We also look very closely at where a child is overall developmentally, because in many instances, probably in most instances, what we expect about advancing textures and advancing oral skills relate very much to the overall development of the child and not just chronologic age. Another professional who's very important is a psychologist, probably a behavioral psychologist. They're the ones who can help you with the refusals of feeding, the behavioral aspects, because many children who have had really some pretty significant medical problems early on, well, the medical problems get squared away, but then these children have learned that it's not such a pleasant thing for eating and drinking, because maybe they've had pain in the past, it hasn't been pleasant, you've worked hard to get them to eat and drink, so that's another member of the team. An occupational therapist is usually an integral part of the team, and that person works with the visual, perceptual skills, maybe sensory issues, learning how to use utensils, and in many instances some of these roles overlap to some extent too. So it's not as though it's a very narrow scope for every single person. And that's why working as a team can become so important, because we can help each other as well as helping the child and the parent. There are differences in what we call multidisciplinary teams compared to interdisciplinary teams. A multidisciplinary team is typically one in which these multiple different professionals see a child and family, but they do it kind of one by one. So you might go to see one person, and then you see another person, and then you see another one, and maybe the communication gets done by telephone or by reports. But what we really like to see, wherever possible, is an interdisciplinary team, because those people function in the same place, seeing your child and you at the same time, and we all talk together. So whenever possible, we do encourage your being able to be involved with an interdisciplinary team. However, you might not need that for significant periods of time. It may be that the interdisciplinary team can help to make plans, and that team might not even be really close to where your home is. So then the follow-up closer to home may be with therapists, maybe with other doctors, maybe with professionals, but then we can all try to work together as a team so that we will communicate with anybody who's following with your child and with you as well. So although I can give some information about this, they differ enough that I want to be careful that I don't make it seem too specific or too narrow that would actually make it more difficult for you to be able to work with whatever teams will work for you and your family. It's not always easy to find these teams, and then of course, although I've mentioned some core members of a team, there also could be some other people who will be helpful. For instance, some of your children need seating support or special kind of seating, and a physical therapist may be helpful to work with seating. A physical therapist may also be helpful for some of the gross motor skills, strength, which can also be important overall to develop feeding. Social workers can be helpful in terms of some resources that may be difficult to find on your own. And then of course there are a whole number of different medical professionals that may be needed at certain times depending upon the needs of your child. I'll give you just a couple. If there are airway problems or your child gets frequent respiratory illnesses, then a pulmonologist and maybe an otolaryngologist work together, because they look at the whole airway from the nose all the way down through the lungs. So those kinds of things are going to differ as well. The most important things are that we are sorting out where the needs of your child and your family are and how we can help to work with all of those kinds of needs to help facilitate the feeding and the swallowing advances for your child and for you in whatever ways work the best for you. The first phone call that you need to make to try to help sort out where the possibilities could be for a team is probably with your pediatrician. And wherever your pediatrician is and you ask about the possibilities for teams, that person should be able to know what the resources are, at least in your general area. It is also true that you may find on the internet, if you Google feeding and swallowing, you will end up coming up with some names of some different teams that may be close to where you are and may be farther from where you are. And most of those teams will have a coordinator's telephone number or an email address that you can then begin to find some information and talk to somebody to see if you think that this might fit with what your child's needs are, and then people go from there. We always want to make sure that we, and this could be the we from many different places, will be the appropriate match for what your needs are and what we can do to help, to do additional testing, but not any more testing than is needed to be done, and help with making a plan, and then really try to help you get the best possible care in the most coordinated way, as close as possible to your home, because that's really where ongoing therapies, ongoing care, ongoing development will be occurring.
We need your help. We need your financial support. You can visit our website to learn more about our organization. We want you to know more about this. Please tell your friends about it. Please be our champion. We need to spread the word, and we're relying on you.